We're going to continue with infection control, but this time we're going to talk about sanitization, disinfection, and sterilization, because remember, that's part of the asepsis technique. So some of the things probably you're not going to encounter in your workplace, but you're going to encounter some questions on your exam. So for that reason, we are going to cover that. And who knows where you're going to end up working. You might end up working in a place when they're going to be sterilizing instruments. So you're going to understand how the process goes about. So that's basically what it is. But there are a few questions from this part on your national exam. So I'm going to be repeating them over and over, and they are highlighted. So you can review them later on whenever you ready to take your exam. So that's basically what it is. Remember, you're going to have all your materials that you can go back and use as a reference to review anything that, probably forgotten because it's long. There are long chapters. There are many lectures. So it's impossible for us to keep all this information together at the same time. So if you don't use it, you're gonna lose it. But whenever you start using something, then things are gonna start coming back to you, or you're gonna be reviewing your notes as reference if that's the case. Okay, so let's go back to this part when we left off yesterday, and we're gonna continue with this part of the lecture, which is once again sanitization. So we left yesterday the part when we were talking about medical clinical hand wash and non-sterile gloves. Remember, those are the procedures and the personal protective equipment that you're going to be using and regular tasks that you're going to do. Remember, for the process of drawing blood, you don't have to wear sterile gloves. They are clinical gloves. These are regular gloves because sterile gloves are totally different. They are packed individually, each pair in each pouch. And after you open them up, you have to use it or throw them out. Non-sterile gloves, on the other hand, or clinical gloves, these are the gloves that we have in a box. And every single time we need to use them, we just remove them from the box and use them, dispose them, and go back again and use them a new pair. Remember, gloves are supposed to be wear only once. You can't be reusing gloves. Gloves are not reusable. So that's basically what it is. So we talk about infection control, how, we put all these 6 elements of the path of infection transmission. So you got to make sure that you understand the steps, because remember, there are a couple of questions from there as well for your national certifications. I will be asking those questions on my exam at the end of this module, so you can keep them, kind of close to you whenever you need them. So let's talk about sanitization. But before we explain what is it, let's talk about 3 things that we are going to be discussing: sanitization, disinfection, and sterilization. So they have their differences. Sanitization, disinfection, and sterilization do not mean the same. The difference is depending on what microorganisms they eliminate. So when we talk about sanitization, we are actually not killing microorganisms. We're just removing the dirt from the instruments that we call scrubbing or debridement. So that's basically what it is. So that is sanitization. Then when we go to disinfection, we're going to go back to sanitization to compare both of them, both of these procedures. And then when we get to sterilization, we're going to do the same. Because once again, it's very important for you to understand, to discriminate between each one of these processes. Think about standard precautions, universal precautions. They are different. They are protecting, yes, but in different ways. So you need to make sure that when you read the questions, you understand the questions so you know exactly which of these particular terms you're going to be utilizing or which answer you're going to be selecting for that purpose. So it says right here, sanitization reduces the number of microorganisms in an item or instrument. So that's basically what it is. Reduces the number. It doesn't say that it kills them. No, it just removes them. Let me give you an example. When we utilize these instruments, let's say we're doing a minor surgical procedure. Just put it a minor surgical procedures. We kind of, working on a cyst. We have a scalpel, we have some scissors, probably have some forceps. And then these instruments, if they are reusable, we need to watch them. That's basically what it is. Sanitation is just to rinse them. So everything that, everybody fluid, any part of the body got in contact with these instruments, we're going to wipe it away. That's scrubbing or debridement. So that's basically what it is. So we are not destroying actually all the microorganisms. We're just cleaning them. Because the next process is going to be sterilization. Now, sterilization, on the other hand, is going to be a process that is going to kill every single microorganisms, including those strong ones that are called spores. So that's basically the difference between sanitization and sterilization. Then we're going to talk about disinfection that is similar to sanitization, but it has a little more of the killing of the microorganisms. So remember, sanitization, the doctor uses the instruments, they are reusable, because if they are disposable, we just dispose them. That's it. We don't have to do anything. And most of these instruments that we use in a doctor's office are disposable. So you don't have to sterilize them. You don't have to sanitize them. You don't have to just clean. Because remember, disinfection goes for cleaning the countertops, cleaning the instruments. See what is the difference? Cleaning the machines I was talking about. So all the surfaces and things like that, where we, use in our laboratory. See, you disinfect your kitchen counter, you disinfect your bathroom, and every single thing, the floors, that's disinfection. We're just cleaning them, we are mopping them, or cleaning them with, if it is in the medical field, we're gonna do with bleach, or, hypochlorite, Clorox, which is the same. So that will be disinfection. So sanitization is mostly for instruments. The instruments have been used, they are reusable. We take them to a special sink and then we rinse them. We're gonna remove all the dirt that this instrument has, right? Immediately. It is so that sometimes we have a basin right there next to the instruments when the doctor is working, doing a procedure with water. So as soon as the doctor uses the instrument, it's not going to use it anymore. they place it or throw it right there on that basin or container with water, and that's it, to prevent blood, tissue, or any other body fluid to stick to the instrument. So that is called sanitization. Because if sanitization and disinfection and sterilization were the same, well, we didn't need to use all these different terms. No, but each one applies depending on what is it that you are cleaning, what is it that you are trying to eliminate during these processes. So that's basically what it is. Use only on items that touches skin surfaces. Now, anything, not just that touches it, that goes inside the body. Anything that goes inside the body, anything that you have to sanitize. Everything, because we're gonna remove all the body fluids that are stuck on these instruments. So that's basically what it is. Remember that during the process of sanitization, these microorganisms are not all destroyed. Sometimes we just remove them. We just isolate them, but they're not destroyed. Destroy means you kill them. Here you're wiping them off. They are going somewhere else in the scene. Some of them might be stuck still in the instruments. So that's why after sanitization, we have to sterilize these instruments, because you're not going to sterilize instruments all dirty. That's not how it works. So you clean them up, and then when they are kind of clean, they don't have all these debris stuck to the instruments. Now you're going to prepare them for sterilization. We will discuss how we are going to prepare all these instruments for sterilization and how these instruments are going to be sterilized. And what are the methods of sterilization that we're going to use? Because remember, you might not encounter this in your workplace. All depends where you're going to be working. If you're going to be working for the doctor's office, I'm pretty sure 99.9% that you're not going to be sterilizing instruments. But if you work in a hospital and you work in any of these departments where they do minor surgical procedures, then you might have to. And if they use these reusable instruments, you might have to do it. You might have to learn how to, so you have an idea. But for the purpose of the national certification, you are going to have some questions from here. So just make sure that, that you pay attention and you mark, you put a note, even though if some of the things are highlighted for you, just for the purpose of the exam. So one of the things that I know that it will be asked in your exam about sanitization is, when you are going to sanitize these instruments, what is the first step that you do? You're gonna rinse the contaminated instruments, articles, items, whatever the case may be, with cold water first. It's not warm water. It's not. You're not gonna scrub them yet. First, you rinse them. Think about when you're gonna wash your hands. When you're gonna do the procedure of washing your hands, what is it that you do? You put soap first? No, you rinse your hands first. You pour some water in your hands. You wet your hands, and then you take soap, and then you start washing your hands. The same we do during the process of sanitization. We are going to rinse those instruments, because during the process of rinsing, most of the stuff that is stuck, that is adhered to the instruments, is gonna fall off. And if there is too much stuff there, then the next step is gonna be scrubbing. So all these stuck, let's just put it that way, that get stuck on the instruments after being utilized during a minor or surgical procedure, that needs to be removed. So that's basically what it is. So the first step, we're gonna rinse them with cold water. Remember, it's gonna say rinse them with warm water. No, submerge them with in a bleach or alcohol. No, that is not the answer. Is to rinse them with cold water. The next step will be scrubbing, because it says right there, rinse contaminated articles or instruments. They use these terms in the lectures, but when you have your questions, it's going to say that you're going to rinse those instruments first with cold water. And then what are you going to do? Then you're going to scrub them. So you do not scrub them and then you rinse. No, you rinse and then you scrub. So that's how it works. Sometimes, we get a little confused, you know, on translation when we just start playing with these questions that they look very similar to each other. And then you wonder, okay, is that the one or is not that the one? So don't get fooled by it. So just think cold water, rinse them first, then you scrub, period. So remember, the purpose of rinsing these instruments and scrubbing them is to prevent coagulation of contaminated materials on the items. So coagulation means that they dry off on top on the instruments. Can you imagine I use a scalpel to cut the skin? What do you think is going to be stuck to the scalpel blade? Blood, tissue. So when I remove that I'm not using it anymore, it's stained with the blood and little particles of tissue. Sometimes you don't see it, but it's there. Or any other substance or body fluid. So we need to rinse them to eliminate that first. So that's basically what it is. Remember, sanitization is not to kill microorganisms. It's not. It does not destroy all microorganisms, particularly spores. Spores are the hardest one. Okay, so any questions about sanitization? Remember, this is for instruments. So this is a little, idea. This is a picture, an image where you can see that the first thing that they do is they start, rinsing the instruments, removing all the debris, all whatever is stuck on the instruments. Now, one of the things that you need to understand is for these processes, you need to wear these utility gloves. You see those gloves that these technician or medical provider is using right there, wearing. These are utility gloves. It's not the regular gloves because they are not going to protect you. These are kind of thick gloves, rubber gloves, that are going to protect you, particularly because sometimes we have some instruments that are sharp, like scalpels, scissors, and other instruments that might cut through the very thin gloves, the medical gloves. So we don't use those. So that's basically what it is. So you have to have them available. And if you see also, the person is wearing an apron or a gown that is waterproof. Because what is the purpose of, watching all this and all these spills are gonna go on your uniform or your clothes? You don't want that. So you gotta wear one of these gowns that are, or aprons that are waterproof so you don't mess up with your clothes. And of course, you gotta wear glasses or goggles to prevent spills or any of these body fluids stuck on these instruments, flowing in through your, into your eyes. You don't want that. So that's basically how it works. Now let's talk about disinfection. Remember, I talk about sanitization, disinfection, and sterilization. Three different things. So sanitization is related to sterilization. Why? Because after sanitizing and scrubbing, rinsing, cleaning, drying those instruments, you're going to prepare them to autoclave because that's one of the best methods, the most common methods that we use to sterilize instruments. We will see that later on in this chapter. Now, disinfection is a little more stronger than sanitization because here, during disinfection, we are going to destroy most of the microorganisms, particularly bacteria. But they are not, this process is not going to destroy spores. Remember, these spores are a very, very strong microorganisms. These are a type of bacteria that they have a double wall. See, for those who took the first anatomy and physiology chapter with me before, which is the cell, we talk about that this cell has a cell membrane. And that membrane is very thin because this membrane is going to allow to pass things in and out the cell. Because cell is a living organism, so things has to go through this membrane. Now, these spores are very, very strong membranes that doesn't allow these antibiotics to penetrate these membranes, so the spores do not get killed. So these bacteria that has spores as, you know, this shelf on the outside of the bacteria are very resistant to antibiotics. So antibiotics do not work for those. So we have to use other processes. So we need to eliminate every single microorganism because we're not going to use an instrument that contains spores there. And then when you utilize these instruments again on another patient, you're going to deposit these microorganisms because they will not die with the process of disinfection or sanitization. We need something stronger to eliminate them. So they are so strong that they are, you know, they resist high temperatures, humidity, and extreme environmental conditions. These bacteria can live in a volcano. Think about it. That is a very extreme temperature. And they don't get destroyed because they are very strong. That's what we use a process that is called sterilization that is going to eliminate them. It's the only process that eliminates microorganisms. Disinfection, sanitization do not eliminate spores, only sterilization. So remember that. That's what I mark them all the time. So you kind of, you know, think about that and review those materials whenever there is a need. So what is it that we do here during disinfection? Now, here is a little similar. Remember, just depends on what is it that we're doing. Here we are going to soak these items or instruments in a cleaning or chemical, cleaning agent, any chemical that you use in your office. But these instruments actually are not used because these are instruments that are used on the outside of the body. We just touch them, so we don't need to go and do different procedures like sanitization and then sterilization. So that's basically what it is. Most of the time we clean them, like for instance, this instrument that we use We just clean them with bleach. Has to be 10%, remember. Or alcohol has to be 70%. But most of the time, the most common disinfectant that we have in the medical field is bleach. Remember, it's bleach or Clorox means the same. Hypochlorite, that's the scientific name, means the same. So Clorox 10%. That's the one that we're gonna clean all the surfaces of the counters, whatever tables or beds where the patients are laying down when they do the procedures, the little tables that we use to put their specimens from the patients, we got to wipe it off. We're going to clean them up. And that is called disinfection. Remember, this is exactly what you do at home. You disinfect. Usually you do not say, oh, I'm going to do sanitization. No, you do disinfection. That's what we do. We clean the counters in the kitchen, the bathroom, and you use all disinfectants like Windex, like Clorox, like ammoniac, like Fabulous, whatever other disinfectants of your choice. So in the medical, we're going to use bleach. Alcohol is very seldom used because alcohol is not a disinfectant. It's an antiseptic because it's used for humans. We use it to clean the arm, any part of the body when we are drawing blood, when we're doing a procedure. So then we use alcohol. So that is a different issue. Or to clean your stethoscope, to clean small instruments that are used to see like a ophthalmoscope. The thermometers, any of those we can use alcohol, but it's not the liquid. We use the little pads to clean them. Bleach, yes, we use the liquids for that reason, because if you're gonna clean a surface, if you have wipes, bleach or Clorox wipes, that would be nice. But most of the medical offices, well, they might not have those. So you have to use bleach that comes in a container, and then you spread it out over your counters, and then you clean with the paper towels. So that's basically what disinfection is. So destroys or inhibits activity of pathogens, no effect on spores. Remember, sanitization, disinfection do not kill spores, do not kill these strong bacteria that are called spores. So that's basically what it is. Any questions about sanitization or disinfection? So remember, keep in mind that the most common disinfectant that we use is bleach. Remember, bleach is also known as Clorox, hypochlorite. This is what we use, and it gotta be 10%. Alcohol is not a disinfectant, it's an antiseptic, meaning we don't clean the arms or the skin of people with bleach. We clean it with alcohol. So that's basically what it is. But sometimes some stuff you can clean it with alcohol, that is fine. But we use mostly bleach. So that's basically what it is. So the most common disinfectant, remember, in the medical is bleach, Clorox, hypochlorite. We will review this back again when we start covering phlebotomy, because up there, we're going to talk about, again, infection control. Not as long as this one, but we're going to touch bases on that one because it's very important that you understand and, kind of keep it in mind that, infection control is very important because we don't want to pass microorganisms to our patients. They already have medical conditions. We don't want to give them more, but be negligent and not cleaning or sanitizing, disinfecting, or sterilizing the equipment that we use. Not to mention, not reusing instruments that are not supposed to be reusable. So this is the disinfection technique. If you see this tech or this medical assistant or this employee is using Clorox, because this is a little bottle of Clorox that is going to be pouring right there on some instruments that they're using because it needs to be disinfected. That's it. So that's all it takes. Why? Because these instruments probably didn't go inside the patient's body. If they didn't go inside the patient's body, they just need to be disinfected. Once again, think about disinfection when the things that you do at home, how you disinfect things. Those things are not contaminated with body fluids from different people. So you're not trying to remove that. You're just trying to remove, other stuff. But you are going to be encountering there some microorganisms because you are in the medical field. So that's basically what it is. Okay. Now we move to sterilization, which is the most effective way to eliminate, to destroy all microorganisms, including spores. So I'm going to highlight it right here because this is a question for exam. Which of the following methods eliminates or destroys all the microorganisms, including spores? Immediately, your answer should be sterilization. It's not sanitization, it's not disinfection, it's not anything else. It is sterilization. It's the only way to eliminate every single microorganism, including those strong ones, which are called spores. So that's basically what it is. So don't forget this, because these are definitely questions for exam. Now, there are different methods to sterilize instruments by using heat, very high temperatures, steam under pressure, which is the one that we're going to discuss because it is more plausible that you will encounter this in your workplace because it is the use of autoclave, which is a very small piece of equipment. It looks like a microwave. Probably some of you are familiar with. Not because you have used it before, but you have seen it before. You heard about this autoclave. Or you work in a place and you saw it. Somebody says, oh, mira, that's an autoclave. Also through gas and chemicals, some liquids. So steam and the liquids are the most common methods of sterilization that you might encounter. Why? Because heat and gas are used by professionals. Gas, have you heard about the gas chambers back somewhere in the world when the Holocaust occurred? That was they did. They put these gas chambers on those rooms, on those showers, and they put the people over there and they kill them. So what they did, well, they sterilized them because these kill every single microorganism. Our body's made of cells, are microorganisms, living microorganisms. So what they did, that's how they kill them, with the gas. Now, in large hospitals, they have a gas chamber, not to kill the patients, of course not, to clean all the beds, the machines, all this huge equipment, beds, mattresses, all those things, they put it right there. Wheelchairs. How are you going to sterilize a wheelchair or a bed in autoclave? There's no way that it's going to fit in there. So they have special rooms, huge rooms, to put tons of things there, and they sterilize them through gas chambers. But that's not something that you're going to be doing. Just for you to know where is this gas method of sterilization and how it's used. Of course, they use it. They're not going to use liquid for a bed or for a mattress. Can you imagine? You will damage them. But they use this gas because gas doesn't damage certain materials, certain equipment, because we're going to see that utilizing steam under pressure, you can sterilize everything, every single instrument, because it is steam, very high temperature. So it's going to melt if I put there a phonoloscope or sigmoidoscope or any other instrument that goes inside of the body with the camera. It's going to destroy it. So this is only for metal and glass. That's how we do it. So that's basically how it works. So there are different types of sterilization, but the ones that you need to understand and know according to your job is, or your title, your profession, is steam under pressure and the chemical, which is some type of liquid, some chemicals where you're gonna emerge these instruments for some period of time, and that will do the sterilization. So that's basically what it is. It's right there. Use on any instrument that enters a sterile cavity or break into the skin. So sterilization is mostly used for all these instruments that actually enters the body. And most of these instruments are reusable. Why? Because they are very expensive. So we are not going to be buying every single time that you're going to do a surgical procedure instruments, because it will be very costly, because there are many instruments that we use during a surgical procedure. You can use up to 50, 60 items during a surgical procedure. Can you imagine buying all of those and that is just one medical doctor doing a surgical procedure? But in a hospital, there are several ORs or operating rooms. So you will need lots of instruments. And we can be buying these disposable instruments because there are some instruments that are not made of disposable. So they are reusable, and we're going to be using them over and over and over. But in order for us to reuse them, you have to sanitize them first, and then we are going to sterilize them. So that's how it works. So here we have a little information about, the methods of sterilization. See, heat, steam, under pressure, dry heat, gas, ethylene oxide, and the chemicals, remember, agents or solution liquids. So that's basically how it is. So just for you to have an idea. But we mentioned them prior. Right here it says heat, steam under pressure, gas, and a chemical agent, which is liquids. So that's basically how it works. Okay, procedure, sanitizing instruments. See, sanitizing and sterilization goes together because this is the first step that we're gonna use, gonna utilize with the instruments. So we're gonna check where we're gonna check how we are going, what chemicals we're gonna use to sanitize these instruments. Well, once again, the MSDS, the material safety data sheets, remember, that is to identify which chemical your institution is using to sanitize these instruments prior to prepare them for sterilization. So that's how it works. Now remember, during this process of sanitization, I mentioned when we were over sanitization, then you have to wear these utility gloves. Remember, I just saw them on that picture or image, and I remember immediately because sometimes, we forget and we think that we can just wash them off with regular gloves, with the medical gloves. No, you have to use utility gloves. Another thing that we're going to do is we are going to separate the sharps from other instruments. Because remember, sharps, we can cut ourselves with it. And when we are cleaning and the breathing, then when we are scrubbing, you don't want to have all of them in the same container or basin. That's going to be dangerous. So you remove the ones that are sharps and then you work on the other ones separately. So that's basically what it is. Once again, this instrument needs to be rinsed first under cold water. Then you are going to scrub them. What are you going to scrub then? To remove or to loosen all the debris, all the stuff that got stuck on those instruments, as I mentioned before. And in order to do that, we're going to use brushes. Similar to those brushes that we use for brush our teeth, there are some brushes just alike and some other difference that goes inside a hollow instruments because you have to go outside and in the inside. Remember the scissors because they have like this type of hinge kind of, movement. You have to go in between, move, open them up and go with the scrub. And that's what we leave sometimes in certain chemicals for a while, for certain amount of hours to try to eliminate most of the microorganisms. And then we rinse them out. Again, we clean it, we dry them, and then we prepare them for sterilization. So that's basically what it is. Remember, you rinse them first, you scrub, and then you're gonna rinse them back again to remove the part that you have to scrub, right? Then you wash them off with clean water, and then you dry them off. Sometimes you just lay them down on a table with a towel underneath and you leave it there for a little while so they can dry by themselves. Sometimes you have to dry them right away because there are some instruments that if you do not dry them right away, they get some kind of marks, some stains on it, and they look like dirty, like you have not cleaned them. Think about utensils in your home. There are some materials, some metals that you wash them off and you leave them there to dry, air dry, and they look like dirty. They look like some spots, dark spots. That is because water just sit in there and leave dark mark. So some of these instruments that you're going to sterilize, you must clean, then dry them off with a towel. And then you prepare them for packing and then sterilization. So that's how it works. So it is a long process. So if you work with someone who's doing surgical procedures or at least minor surgical procedures, and they use these reusable instruments, well, so this is what you're going to be doing all the time. I did this when I was a medical assistant. I learned this firsthand. So I know what I'm talking about. I know what I'm telling you because I actually went through this. Because I work in a hospital. I work in different departments. I work almost in every single department in the hospital in 4 years that I was there. So I have the opportunity. I learn. But you don't have to go through the same steps that I did because depends what department you're working on. So that's basically what it is. Says right here, performing chemical sterilization. Now for chemical sterilization, once again, we're gonna go and we're gonna check the manual and we're gonna review the MSDS. Remember the material safety data sheets, because this is where all the information about the chemicals that we're gonna use, that we're gonna utilize to do all these processes of sanitization, disinfection, or sanitization, you're going to use all these chemicals, even for sterilization, because if you're going to use certain gases, well, you need to know which one is it that is being used for that process. But here we go a much basic level. So that is basically what it is. Now, think about what I mentioned before. Why do we use these chemical agents to sterilize instruments? It says right here, this type of sterilization is used for items that are sensitive to heat. Can you imagine a colonoscope? Because these are scopes and they are made of rubber. And can you imagine putting them at high temperature? It's gonna melt. So we're gonna damage a very, very expensive instrument that costs like between $10,000 to $25,000. Can you imagine you put it in a heat or an autoclave? Well, just gonna damage it. So we're gonna use these chemicals for those instruments. Remember that they are sensitive to heat. Remember that for your exams, because they're gonna ask you, not necessarily they're gonna ask you, okay, what chemicals you're gonna use? No, they're gonna use what instruments or which instruments you are going to sterilize utilizing these chemical agents. Remember, when they said chemical agents, they're talking about liquids. So that's basically what it is. Now, if they tell you sterilization using, steam, then that's a different issue. Then you're gonna remember, because I'm gonna tell you, it is called autoclave, because those are the two most common methods that medical assistants are going to be exposed to it in the medical field. Any other method, you're not gonna do it. They're gonna have a specialist who's gonna be doing those, because they are very complex and they are, you need some other type of training for those purposes. So, or to work doing that type of sterilization. So for this purpose, remember, you need to wear personal protective equipment. These are chemicals. Every single time that we are handling, manipulating chemicals, what is it that we have to do? We have to wear personal protective equipment. Whatever is needed. Remember, we don't need anything to splash in our clothes, our skin, our eyes, anywhere. So we're gonna wear the appropriate garment needed for that particular procedure. So that's basically how it works. So you first going to clean, you're gonna sanitize, or you're gonna disinfect the instruments, and then you're gonna use this process. You do not use these chemical agents to pour those instruments or immerse those instruments dirty. No, we are going to clean them off first through the process called sanitization. Remember, you rinse them with cold water, then you scrub them, remove all the debridements from these instruments, and then you put them in a container or a basin where it's filled with all these chemicals that we're going to use, and you're going to cover them with that chemical. Every single instrument has to be immersed. The instrument should not be pumping up of the chemical. The chemical has to be above the instruments because it needs to do its work. So that's basically what it is. So there are different types of chemicals. One of the most common is this one right here, glutaraldehyde. This is usually the most common use. It comes in a container just like bleach, and it says the name over there, and you're gonna read all the information about this chemical and what are the side effects, what it does, what happens if you get exposed to it, how you have to render yourself, the first aid or someone else. So that's basically what it is. So once again, you're gonna leave those instruments according to, the MSDS in the manufacturer company. If they said that these instruments need to be there under these chemicals for 12 hours, you have to leave it for 12 hours. If it is 24 hours, you're gonna leave it for 24 hours. It's not 1 hour, 2 hours. It's 12, 24, 48 hours that you might leave those instruments. Remember, you are sterilizing this instrument. You are killing every single microorganism, including spores, because this is a method of sterilization. Last but not least, you are going to cover this container or basin, whatever uh, you know item you're using to sterilize this instrument. You have to cover it up. It has a lid, so you have to put it to cover it and leave it there for the time that the manufacturing company has agreed with, and you follow all these directions. Then after 24 hours, so 12 hours, 24, or 48 hours, you're gonna remove them, you're gonna rinse them, but you're gonna rinse them with sterile water. It's not just regular water, because then what is the purpose? Remember, these instruments have been sterilized. So if you use tap water, you're gonna contaminate them back again. So you're gonna remove them, you're gonna use some type of, item or instrument to remove these instruments from that chemical. You're not gonna put your hands, even though if they are glove, inside. No, you're gonna remove them with some type of instrument, put all these instruments outside on top of the towel, then you're gonna rinse them off with sterile water, remember. Then you're gonna dry them off with an sterile towel, not a regular towel, because then you're gonna contaminate them. Now, when we are using sanitization or disinfection, we don't have to use sterilization. We don't have to use a sterile water or a sterilized towel. No, because they are not sterilized. But this is the process of sterilization, chemical sterilization. So for that reason, after you keep them in that particular chemical that has been sterilized, now you're gonna rinse them out and then you're gonna dry them off. Remember, if you don't dry them off, they're gonna have marks on those instruments. And when we open this package with those instruments, they look dirty. And if they look dirty, we're not gonna use it. So then the whole purpose of sterilizing was a waste. So we have to do the steps correctly, follow all the steps. So it makes sense. Think about it. If these instruments have been sterilized in that chemical, they need to be rinsed with sterile water. Now, the first time when you sanitizing, then you're not gonna use sterile water. There's dirty. You're gonna use tap water. But after being sterilized, being in this chemical, immersed in this chemical for a period of 12, 24, or 48 hours, then you're gonna use once again sterile water, and to dry them off, you're gonna use sterile towels. Yes, there are towels that we use. We put them in one of these autoclaves or any other, equipment that you have there to sterilize those towels, and then they are reusable. They have to be washed off, and then they put to sterilize, and then you're gonna use that. So that's basically how it works. Any questions about preparing this instrument? Oh, I'm sorry, sterilizing these instruments using the chemical agents. So that's basically what it is. Now let's talk about using steam under high pressure using an autoclave. Remember, these are questions for exam. So autoclave is one of those instruments that we use a lot to sterilize instruments. It's just that it is small. So it is to sterilize not many instruments. And this is for small instruments and for instruments that are continuously used. So we have to be, going through all these processes, sanitizing, then sterilizing, disinfecting, and then sterilizing, whatever method is used. But that's how it works. Used to produce steam under pressure. So once again, the way that it works is, through, we put some water, but we're going to see what type of water we're going to put in this particular items. So needs to be understood, because other than that, and well, it's not going to be any purpose though. See, it said right here, primary method for sterilizing instruments in a medical office. Because remember, this is a small piece of equipment. So it's going to fit in any counter in any laboratory of a medical office. If it is a hospital, they're going to have different approaches to do this, because these hospitals are huge. They have an OR, they have operating rooms, not one, they have 5, 6, 10, 20 operating rooms. And has all these people, that are admitted in the hospital. So they have to sterilize mattresses, they have to sterilize all these beds, all these wheelchairs, all these crutches, all these canes, all this equipment. So can you imagine? You just put everything in that particular room and turn on the gas, and that is it. It does the work. Here is just a small piece of equipment. So just for you to have an idea, this is an autoclave. So it's very, very, very basic. It's mostly manual. Now we have automatic ones, but this is done mostly manually. And because of the price, remember. So if you have to work on it, somebody's going to train you, but I'm going to walk you through, and believe me, this is not difficult to operate. Just for you to have an idea. See, it looks like a microwave, and it's the size of a medium microwave. So that's how it works. So let's go back here again. So can be automatic or manual. We're talking about the autoclave. It works under steam. It works with steam under pressure. It destroys microorganisms, including spores. So remember, the only way that we can eliminate all the microorganisms, including these very strong microorganisms, bacteria that is called spores, is got to be through a process of sterilization. It's the only way. It can be chemical sterilization. So don't mix things up, because I have students that, oh, sterilization. And then they said, oh, Professor Hoyer said that it was autoclave. No, I didn't say that. I said it can be through a chemical agent, liquid. You immerse all these instruments over there, because if they are sensitive to heat, then we have other methods. There are gas, there are heat that can be used. So it's not just autoclave. So pay attention because I mentioned all of them because you don't know which question you're gonna have, which answer you're gonna have in your exam. Remember, there are different types of exams. It's not the same exam for all of you. Some of the questions will be the same, but most of the questions are different. So some of you are going to have autoclave, some of you are going to have the chemical, some of you are going to have gas, some of you are going to have a heat. So you need to understand all of them. That's why whenever I give you an exam, I put all the options, and at the end, the last option, I said all of the above. Remember, if I give you all of the above, that means that is the correct answer. Don't just pick one of the answers. Oh, I know this one. What about the rest? Remember that the tips that I gave my students to take exams, that's one of them. Now, your national exam is not going to use the same type of options that I give you. Not it's multiple choice, it's a single answer, that's it. But I give you multiple choice because all of the answers are there and you don't know which one you're gonna have. Once again, you might have heat, you might have autoclave, the other one might have gas, or you have the chemical agent. So if I give you only the autoclave, what are the other options? Oh, Professor Hoyer, you said that the only way to sterilize was autoclave because you didn't mention anything else. So if I give you these options, now you're gonna know all of them apply. So when you see any of those options in your exam, you know that one of those options is the answer. They're not gonna put all them together because there is no all of the above. They don't give you this type of questions on your exam as a single answer. You don't have, this is not a fill in blanks. No, this is not an essay test. No, this is a multiple choice. There is only one answer. And all of the above is not going to be an option. So don't think about that. For that reason, I give you different choices because I don't know which one you're going to get on your exam. I don't make the national exam. But I do know more likely what questions are going to go there. For that reason, I go over with you all the possible answers. So I give it to you. So that's basically what. So now, once again, I mentioned this because every single time that I give you an exam and I give you all of the above, some of you just disregard all of the above after I've told you. If you have a question in any exam, but not the national because it's not going to come, but in any exam that is being given, if you see all of the above, usually 99% that's the right answer. That is it. If you have A and B, oh, that usually is the right answer. Or A and C, whatever the case may be. They're giving you two choices because there are two answers. So it can be either or because you don't know which one you're going to have. So think about that because taking tests is more like a technique. I have told my students prior that whenever I'm taking I take tests all the time, not because I'm doing any programs or anything like that, or any courses. No, I take tests because I want to challenge myself to see if the techniques actually work. There are subjects that I have no clue about it. I'll go there and I pass the test because I use all the tips to take exam. So you don't have to be a brainer. Who's gonna remember all this information anyways? But if you understand the the cues, all these tips, these techniques to take exams, then you're gonna pass. most definitely. So that's basically how it is. So don't disregard any of the tips that I give you, because then you're gonna encounter yourself in a very tough, spot. So basically, that's what I want you to do. So, oh, I thought it was not recording this. So, okay. So what will be the pressure at which this autoclave needs to be set up? Now, it's not that you have to do all these. Some of these machines already are set up to that particular, they are by default, they are set up already. But if they are not, the only thing that you have to do is go to the button when it says pressure in pounds, 15. Temperature, Fahrenheit, 250 or 270. Depends what the instruments you are doing. Depends of the policies of your organization. What is it that they use? So if you just place it 250, fine. What is the period of time? 20 to 30 minutes. All depends what instruments. So you need to have the instruments. I'm not gonna say, oh, it's gotta be 20. Oh, it's gotta be 30. Each organization has different standards, guidelines for sterilization, because they do different procedures. They have different instruments. So you have to follow their policies, the manufacturer policies, but most importantly, the place where you work in, because I don't know which this autoclave are you using, whether it's automatic or it's manual, whether you have to set it up or it is already set up. But once again, very important to understand, particularly the temperature. 250 to 270. Remember, these are Fahrenheit, because here in this country, we use Fahrenheit. In my country, we use centigrades or Celsius, which is the same. Here in the US, we use Fahrenheit. So that's how it works. So remember, the temperature at which you have to set up your autoclave is going to be 250, because the answer is going to be 250. Now, if you see 250 to 270, well, that's the right answer. But most of the time, just set it up to 250. That should be the answer for you. Any questions about autoclave? We just started. We still have to go to the whole process of, preparing these instruments after being sanitized, dried off. Now we're gonna package them, different types of packaging, and then you're gonna sterilize them. Then you're gonna prepare the autoclave. Then you're gonna fill the reservoir with distilled water, because it's not just tap water. It's not sterile water. It's gonna be distilled water. So we're gonna go through all that, because those are questions for exam. And it's important that you know, because when you start working, it's not that you're gonna know everything, but you have an idea. Someone says, listen, this is an autoclave. Oh, do I have to use autoclave here? Yes. Oh, wow, that's nice. Can you show me how it works? So sometimes some people are gonna be nice to you, some people are gonna be rude to you, some people are gonna tell you, oh, wow, didn't you just graduate from the school? Didn't you learn over there? Say, yes, I learned how to do it, but learning and doing it are two different things. Just be nice with them. Say, yeah, you know what? We went over the lectures, but we never practiced that. So now that I have it in front of me, let's apply the lectures. Let's see how it works. So that's basically how it is. Never get into somebody else's skin, because remember, you are the new kid on the block. You don't want to get confrontational with no one in your workplace. So please stay keep yourself calm and try to learn as much as you can. Uh, Scan people around who might be nice to you, who might not be. And whoever kind of nice to you, ask the person to help you, to show you. Oh, whenever you are using the autoclave, can you show me how it works? Or use what I use all the time. Hey, didn't you learn this? No, because we use a different one. This looks totally different. And actually, it's kind of nicer, though. The one that I have at school was an old one, even though if you never seen it. That's what I do all the time. Because other than that, people is gonna take it back. So no, don't give the opportunity to no one. Oh, you're new here, right? Oh, I haven't seen you here. Are you new? No. Well, by the way, I knew here in this department now, but I was working in another department in this hospital or in another hospital. Who's gonna go find out? We're gonna, hire an FBI agent to find out? No, you don't have to tell people where is the truth. Just go by the flow. Don't explain anything to no one. Don't blame me or don't blame the school or anyone else. Oh, no, they didn't teach me that. No, they didn't say, no, nothing. No, we don't say that because whenever we say that, we look really bad. So that's basically what it is. You don't have to make me look good at all, but you have to look good yourself because it's you, the one that they are being, put on the spot. So there is lots of ways that you can defend yourself without being confrontational. I'm being through a lot of stuff. I'm telling you this based on my experience. So listen, you're gonna get nervous whenever someone approaches you, whenever someone kind of question you, testing you. There is always a smart, A over there that wants to show off and try to question you and put you on the spot. Oh, don't panic, don't say anything. Said, oh yeah, I learned that. But when you're in school, you learn so many things that until you start practicing and practicing many times, this is not gonna sink. Other than that, it's gonna be like, I did it once and I forgot how I did it. So that's how you are going to put yourself. So once again, autoclave, very important. Remember, this is an equipment that is used for sterilization of instruments, mostly in medical offices. Remember, because this is a small piece of equipment. Dental offices, they also have this because dental office is a medical office. It's just that you're not a dental assistant. You're going to be a medical assistant. And remember, it's gonna use pressure, steam under very high pressure. That's basically what it is. Can you imagine a temperature of 250 degrees? That's a very, very, very high temperature. So again, don't panic. Don't stress yourself out thinking, wow, all this information, how am I going to remember? Do you think that when I learn all this, I remember everything? No, I didn't remember much. And I was in a deep trouble, as I mentioned to my other students that they're being longer with me. Then when I went to the school, I didn't even speak English. That was tough. You guys speak English, so you're not going to have much trouble. I have a lot of troubles because of the language barrier. But here I am. Now I'm teaching. See, anything is possible. If I made it, anybody can make it. So you can make it. Anyone. So that's basically what it is. Any questions about the autoclave or whatever we have covered? Because we have more. Okay, so before we are going to be using the autoclave, We already sanitized those instruments. Now we are going to wrap those instruments for sterilization. Pay close attention to this because there are like 4 or 5 questions from this part of the packaging or wrapping of instruments that you will have on your exam. So I'm going to tell you which ones are, and some of them are highlighted. So keep it in mind, because remember, one of the things that we mostly are afraid of is just taking exams. Who's not afraid of taking exams? I never heard anyone say, I love taking exams. No, I don't like interviews. I don't like taking exams. I don't like any of those things. Ask me, go try to do that. Hey, I will look my way. But anything else is very difficult for all of us. It's an emotional situation. So again, still, fortunately, we have to go through certain things, and testing is one of them. Interviewing is another one. But if we are prepared, if we have some knowledge, some basic knowledge, we're going to be able to pass. So that's basically what it is. So what is the goal of wrapping these instruments for sterilization? So we are going to maintain sterility after sterilization. Yes, I'm packing, I'm wrapping all these instruments. Why? Because we are going to keep them sterilized for certain period of time. Think about something, your utensils are at home. You have something that you use not every single time. So you're gonna keep it, in a package, something like that, in a box, in a plastic, wrap it up with something so it doesn't get dusted, it doesn't get, it doesn't get dirty. So we do that. Well, now we have instruments right here. And these instruments cannot be sterilized and then put it outside or put it inside any drawer without a package. No, they have to be protected. They have to be covered. So that is the purpose of wrapping those instruments. Now, are every single instrument needs to be wrapped? No. There are some instruments that don't need to be wrapped because these are instruments that not going to go inside the patient. If they are not going to be inside the patient, we just sterilize them just to remove microorganisms that might be there because of contact with some body fluids, but they weren't inside the body of the patient. So for that reason, sometimes we just sterilize them, but we keep them unpacked, unwrapped. So that's basically what it is. Now, these packages, because there are 3 types of, there are 2 types of packaging that we're going to use. We're going to use these disposable muslin paper wrappers, and we're going to use disposable paper pouches. We're going to see then I have pictures, and we're going to watch a little video so you can see the real thing, how it works in the real world. So that's basically how it works. So if it is the paper or the pouches are like a little bag. That's basically what it is. Well, not little, comes in different sizes, depends on what type of the size or instrument that you're going to place in there. But we're going to talk about a little bit the difference between those two. So this muslin paper, this is just like some type of paper which you lay down and then you place the instruments inside and then you start folding the paper to wrap them up. So that's basically what it is. The pouches, this is just bags and you're going to put the instruments over there. Gonna see other things that you have to do, because remember, when you use all these wrappings, you need to know what instruments are inside. So you have to mark them, you have to label them. So that's basically how it works. So this is the muslin paper. Now, this was one of the all methods that we use. I use this a lot myself for sterilization. And this is special paper, has to be kind of, a very porous paper, because it needs to allow steam to go inside. This is not a paper that is kind of solid completely. No, this paper is like, tissue kind of thing. It has a little perforations, holes, if you will, very tiny ones, little pores that allows the steam to go through and pass through all these instruments and kill all these microorganisms, still keeping the instruments sterile because they are wrapped. That's basically what it is. So there are different methodologies to do this. As you can see, you can place the paper like in this diamond kind of shape facing you, and then you put the instruments like you see on the second image, or the image or picture number 5. And then you start wrapping them up. This is just a demonstration, because you're not gonna just sterilize a forceps, because those are the ones that are there. These are the thumb forceps. No, you're just not gonna put that. You're gonna put more instruments. You're gonna put like 5 or 6 medium-sized instruments, or one a little larger instrument. So we cut this paper accordingly. So that's basically what it is. It's like packing or wrapping a gift. Of course, the gift is like a little more kind of fancy, right? Here, we don't care about how nice it's gonna look like. We're gonna make sure that all the instruments are covered, are protected inside. So that's how it works. Here it is. Here how it is folded. See, they have a special technique to fold these papers. So the reason that you have to use all these techniques to fold the little tips at the end of these corners is because when you are unwrapping, you're gonna pull them from these little tips or ears or corners or whatever you're gonna call. So that's basically what it is. And then you're gonna wrap them up. Remember, it doesn't matter how you wrap them up. The issue is that when you are going to unwrap them, because you're gonna be using them, it's gonna be easy to do it and not to contaminate the instruments that are inside. So that's how it works. Here it is. So this is the wrapping process. Now, these are the pouches. Remember, the pouches are just like envelopes, and it has an adhesive that just like envelopes, the new envelopes that we have now, like the manila envelopes, and it has a clear window on one of the sides so we can see what instruments are there. So in this case, for this muslin paper, we have to put a list. We have to label them. First, the date that these instruments were sterilized. Then a list of instruments that you put inside, because you need to know what instruments are inside. You can't just put instruments over there and then, okay, so what is in this package? No, you have to put a list, so you're gonna label them. And then you're gonna seal them. How are you gonna do that? We're gonna use some type of tape, autoclave or sterilization tape to seal this, to kind of secure the package of the wrapping. Now, there is something that you're gonna put inside that we're gonna mention later on. So these are the pouches. Now we're gonna go and let me see. Yes, we're gonna watch a little video and you're gonna see exactly how this medical assistant is wrapping up the instruments. And she's gonna walk you through, she's gonna tell you everything that she's doing. So I'm just gonna stay here and watch the video with you, okay? So let me first share the window with you. Okay, this is the video. Pay attention to it. It's very simple. So I'm not gonna interrupt you to do anything. I'm just gonna watch it. And when we finish, I'm gonna go over certain details. Or I might pause the video and I'll tell you, this is it. This is what they placing inside. This is the tape. This is the instruments and so on and so forth.
I can't hear it.
You cannot hear it?
No.
Who else cannot hear the video?
I can hear.
Okay. Let me see what seems to be the reason. But you can watch the video, right? Can you see the video?
Yes.
Yeah, I can see it.
Okay, let me see what's going on right here. Okay, let's try this. Now, can you?
No.
No.
No? No sound? Oh, well, I don't know what to do with it. Not good. I was so excited to show you the video, but I don't know what else to do here. Let me check this. No. And I have the speakers all the way. Special audio. Okay.
We can search online, right?
Yeah, no, I have it right there. I have the link right there. It is within. Okay, check this out now. Still not?
No.
No.
Oh my goodness. Anybody has an idea? How should I?
Maybe we can search online.
Oh, because
I
I never
can't
use.
hear. Do you check? You see where the red line is at? Can you check if it's mute? No, it's on speaker.
Yeah, it's on speaker. Are you ready?
Maybe it's your laptop. Go to your settings on your volume on your laptop.
I already put all the volume. Yeah, I put it the highest one.
Wait, let me just take a screenshot of this just in case.
Remember that the link is right there. So if you don't have it, I can send it to you. You can watch it off. It's very interesting. There are two videos, part one and part two. The part one is the wrapping of the instruments. The part two is where you use the autoclave. But you can watch the video even though, okay, you know what? Let's put the captions. So you can read it. At least. Okay, so I'm gonna stop right here to tell you that what she's doing now, she's putting a strip indicator. Now, later on when we finish this video, remember it's very important for you to understand that there are two things that we're gonna do when we wrap these instruments. One, we're gonna use a autoclave tape. The tape is to secure the package, totally different from the indicator. The autoclave or sterilization indicator is a little strip that we're gonna place inside with the instruments. That's what she did already. That indicator is the one that is gonna tell us whether these instruments are sterile or not. So that's basically what it is. So pay careful attention to this because later on I will explain you better when we get to the tape, the autoclave tape and the sterilization indicator, because there are two different things and these are two questions for exam. But I just interrupt you to let you know that what she's putting right there is the sterilization indicator. This sterilization indicator is a little strip and it's going to be changing colors. So when we unwrap this package, if this indicator has not changed colors, then the instruments inside are not sterilized. So we cannot use it. Has to be sterilized again. So it has to be wrapped again, not clean, wrap again, and put another sterilization indicator and put it back on the autoclave. So that's basically what it is. Continue.
I like to get rid of some of the excess.
Okay, we're gonna do another pause right here. See, this is the autoclave tape. Now it says it is an indicator. Don't mix them up. This is not the indicator, actually. What it's trying to tell you is that it indicates that this tape is gonna change colors as well. But this tape is gonna tell us that these instruments were autoclaved. Being autoclaved does not imply that the instruments are sterilized. They were put on the autoclave. That's what the tape changes due to the changes in high temperature. But that is not used to determine whether the instruments that are inside are sterile. After we open this package, when we are about to use it, then we're gonna look inside the sterilization indicator. That is the only one that can tell us whether the instruments are sterile or sterilized or not. This is just the tape for us to know, hey, these instruments, this package was sterilized. It was autoclaved, but doesn't guarantee that the instruments inside are actually sterile. I hope you didn't get confused. We will talk about that. It's just that I interrupt you to let you know what is she doing and what is this tape. This looks like a regular tape, but it's not a regular tape. See how it's gonna change colors. This now is kind of beige color, this tape. Later on, when it's finished of sterilization, after it's being autoclaved, now you're gonna see some stripes on across the tape. And that is what the indicator that she's gonna talk about. The indicator that these stripes are the indicators that these instruments were autoclaved or sterilized. So that's basically what it's trying to tell. Now we can see the difference. See, these are the stripes right here. The tape was completely plain, only beige color, but after it's been autoclaved, remember when I said autoclave or sterilize is the same, because the autoclave, we use it for sterilization. So you can use this term. These terms are interchangeable. So you can use sterilize or they were autoclave if an autoclave was used for that purpose. So that's basically, you're gonna see all these lines across. These are black or dark lines. Now we know this package was already autoclave. Now this is not going to prove that the instruments inside are sterile. So that's a different issue, because inside we're gonna have the indicator of sterilization that probably we're gonna see it later after it's being autoclave. Here's just for you to, give you an advance of what's going on. Good. Any questions? I was trying on my phone, trying to figure it out, how to do it, but I'm gonna try to do it tomorrow. I thought that, it went straightforward. I never, show you guys a video through this platform because I use different platforms in other classes. So I was like, okay. Anyone figured it out how to do it? No. Right? Can you guys hear me? Hello? Hello?
I'm sorry. I was trying to follow it on my phone.
Oh, I'm so, no, but no,
I'm
I just
sorry.
want to make sure that you guys are that I didn't move something that now I got blocked completely.
Yeah, I couldn't follow the caption, so I just looked it up on my
Yeah,
phone.
no, the captions usually are fast, and if you using a cell phone, you're not gonna see it. Are very small. Yeah, I'm gonna try to figure it out, but one of the things that I can do is I can send you the link if you didn't have it on your PowerPoint that I sent you. I can send you the link so you can watch it on your own time. It's very, very interesting. So you can do that. Okay, so let's do the second part because it's using the wrapping, using the pouches, and then using the autoclave. So that's basically. Oh, you're not supposed to be giving me commercials, okay? I paid for this exclusive. Okay, so these are the other methodology to sterilize instruments. These are using the pouches, remember. Now, these pouches has two advantages. Number one, you don't have to wrap anything else. You just put it inside this envelope-like item, and then put the instruments. Now, see this bar, this black bar right here on top of the pouch? This is the indicator strip. So we don't have to place an indicator within the instruments. The indicator, it is within the pouch. Whereas with the muslin paper, because it's like more manual, more like basic wrapping of instruments, we have to put the indicator inside. Here, we don't need to place an indicator because the pouches already come with the indicator. One of the disadvantages about these packages is that they are very expensive. So most of the doctors, if they are using an autoclave in their offices, what they're gonna do is they're gonna have the muslin paper because it's very cheap. So you just have to wrap them up and put the indicator inside and secure the package with the autoclave tape. But this one, the indicators comes on the outside. And another good thing is that this package on the other side is clear, so you can see the instruments. So do you need to mark them? No, you don't need to put labels. What you need to do is to place the date that the instruments were sterilized and who sterilized them. So the initials of the person who sterilized them. So that's basically what it is. So that's because it doesn't have a sound, so I wanted to make sure that you follow this. But I will send you the links to all of you, so you can watch these videos whenever you have time, so you can get a better understanding how these instruments are, wrapped or put in these pouches to be sterilized, and all the steps that we have to follow to identify them. So basically, or to label them. Okay, once again, remember the water that we're gonna use for, the autoclave to produce this high pressure steam has to be distilled water. Remember, questions for the exam. Gonna have it later on this chapter, but I just pointed it out now that you know, this video is depicting that part. So we're gonna use distilled water. So you gotta make sure that whenever you see a question on your exam that says, okay, what type of water you're gonna be filling in the reservoir from an autoclave? So you look for distilled water. It's not tap water. It is not sterile water. It's distilled water. So don't forget that because that's important. Okay. Okay, so that is it. This is how we use an autoclave. Let me go back to the lectures. Here it is. So any questions about the video besides not having volume? Please, my apology for that, but you know, I thought that this just functioned that way. Any questions? Oh, wow, we just made it on 7. That was not even programmed to do so. Anyway, so let's take a little break, and when we come back, we are going to discuss a little bit something over the wrapping, the tape, the autoclave tape, and the indicator of sterilization, and a little more about the autoclave, because there was certain little things left off in the video that I'm gonna tell you. So once again, that was just a demonstration from this person of the autoclave. Was very basic. That's all we need, but there are little points there that we need to kind of go over when we come back. Okay. So at the meantime, I'm gonna try to figure it out how this thing works with the videos. All right, enjoy your break. We come back at 7:40, and then we continue with this chapter. Okay. Get some rest. Hello, welcome back. So I tried to figure it out, the video and things like that. I move a lot of stuff, but I don't know if it works or not. So you're gonna tell me if it works or not. Let's try and let me know. Okay, so are you guys back?
Yes, we're back. Thank you.
Okay, so let's check the video again. I believe this is the video. And let me know if you can hear anything. Can you guys hear anything?
Not, nothing, nothing.
That's not good. I move a lot of stuff, but no, I have to ask someone else too. So when I finish, I'm gonna go over it again and see what is it. What's the problem? Okay, so let's move on. Let's continue with this chapter. Unfortunately, didn't work. So, but I put in the chat. Somebody request for the link. I place it right on the chat so you can copy it, or I can email it to you. Whatever works for you. That's what
Yes.
we're gonna do. Okay.
Can you email it for me, please?
Okay. Good. No, I'm gonna
Thank
email
you.
it to all of you. So,
Okay.
but you
Thank
have
you.
it on the chat anyways, just in case.
Okay.
You know, you can try to pull it out from there and see if it has sounds for you, because that's the most important thing, that you get this sound, and let me know how it go. Okay, I hope you guys enjoy your break. I actually ate something and then I start working on this sound thing and see what was wrong with this little video clip that we couldn't hear. Okay, so we went over this already. We check it out. Do you guys have any questions about whatever you saw in the video? I tried to interrupt the list so you can watch and you can understand, but there were some points that were very important to address, and that is the reason that I interrupt, because you weren't able to hear what was said. And also, there are some points that are very important for us to know. So here are some of the points that we are going to kind of bring up or point out. Remember, the autoclave has to be filled with distilled water. It has to go all the way to where the fill line is at. This is like, when you have a measurement on certain containers that you have to reach that level. That's exactly how it has to be done. Because if you kind of fill this reservoir um, below the line, the filling line, or above, it's not gonna work either or. It has to be exactly on that line. It's not that if I put a little more water, it's better, and if I put a little less, it's gonna heat up faster. It doesn't work that way. So again, this is a question for exam. They're gonna ask you, what type of water you're gonna fill the reservoir for the autoclave. Then once again, you're gonna have tap water, you're gonna have distilled water, you're gonna have sterile water, you're gonna have some saline water. It is distilled water. That is it. Now, what is the purpose of using this water and not the tap water? Because the tap water has many contaminants within, lots of chemicals in there, and that can block certain chambers that allow this steam to come out. So it's like blocking all the little tubes that allow the steam to come out. So for that reason, it has to be distilled water. So that's basically how it works. Now, once again, the video, you saw in the video, the person trying to, set up the temperature to 150, the time to 30 minutes, but it goes from 20 to 30 minutes, depends on the instruments that you are about to sterilize, or according to the manufacturers of the autoclave. Remember, they will tell you if you are going to be using these particular instruments, it has to be for this particular time. That's why, they use a standardized time or a range of time between 250 and 270 Fahrenheit degrees versus just giving you one number. Or it's gonna be only 30 minutes. No, all depends on the manufacturers of the autoclave or the instruments that you're gonna place to be sterilized. So that's basically what it is. Now, for the pounds, remember the pressure comes in pounds, and that will be between 50 and 17 pounds. So all, again, we go back to the manufacturer guidelines of the autoclave, so we follow just that. When you start working, if you have to use an autoclave, they're gonna train you, because it's very important that you do the things right. This is not about you learning or not learning at the school, whether you practice or didn't practice, whether you have experience or not. Every single office, every single medical hospital or medical office, they have different equipment, different brands. So that's what I was mentioning before. So whenever someone asks you, oh, well, you don't know how to use that, and you just graduate from medical assistant school, I said, yeah, but we have a different equipment. The autoclave that they have over there, that was a different one. This is a lot nicer, a lot better. Make them feel like they want to teach you something that you're going to learn from them. Never put them down. Let them believe that they are the best over there and that you're going to learn from them. Learn from me, because that's what I did. You have to become an actor when you start working. Because there are people who's going to make your life miserable. There are people that's going to be nice to you. But don't expect that people is going to be nice to you. You have to be nice. You have to be nice. You have to be approachable. You have to ask questions in a very professional, nice way. That's basically what it is. If somebody tell you they refuse to help you, or you notice that they don't want to help you, don't push. Leave them alone. Move to someone else. Tell them little good things that they want to hear. That's what you have to approach them in a different way. Tell them how nice they are. Patients are talking really nice about you, even though if it's not true, make it up. so you can gain some territory with these people. Because there are some people that are going to be very jealous when you're new in the job. I always tell my students how to behave because this is very important for you to hold the job. Remember, you're the new kid on the block, so everybody wants to control you, and you're going to be terrified. You're going to be nervous. Remember, when you start working, we're going to be nervous. This is a different environment for us. This is a new arena, new people that we are starting getting to know. What do you think I went through? I went through a lot of stuff. But I know my ways. I make you feel good. I make you believe what you think you want to hear. That's it. I'm going to tell you what you want to hear. I'm going to tell you good things about you. Good morning, good afternoon. Wow, how nice you look today. I mean, look at your hair. Look at your dress. Look at your shoes. Even though if they're horrible. It's all damn good things because believe me, you're going to put these people in your pocket. I was the only male medical assistant at the hospital when I started. There were no male medical assistants. And I'm not talking about 1800s. I'm talking about 2000 and something. So once again, that's how it was. And people were a little jealous about me taking somebody else's job. They don't want to teach you. They don't want to tell you anything because they think that you are getting their jobs. No, you're not going to get their jobs. Well, at least that's not what you're going to make them believe. No, I'm here and I want to learn. Wow, you're so good doing this. Wow, I heard a lot of good things about you. So then immediately they want to teach you. But if you go there with an attitude, guess what? That might be your first and last day. I can guarantee that. So be nice with people. Or at least pretend to be. Act. Become a good actor. Because we have two faces. Or three. You have like 10. Depends who you're talking to. You got to talk in certain ways. You don't talk to your coworkers the way that you talk to your family members or vice versa. So you have to get your way. And the only way to do that is to make some conceptions. You have to accept certain things. You're new there and kind of, go with the flow. Once again, try to be very nice, try to be very helpful. Oh, well, listen, there is something that I can help you with. Oh, you're doing something right there. Can I assist you as well? Even though if you don't want to help them, but just gaining territory, gaining confidence with these people, because otherwise they're not going to help you. If you are trying to help them, they're going to say, wow, this person is really nice. I'm going to help them. But if you're rude, they're not going to help you. So be careful. You have to gain that trust from people. And you have to present a different persona. If you're a person that, you have a bad attitude somehow at home or with your friends, hey, these people are not your friends. This is your workplace. So you're going to act differently because you want to hold your job. That's what we do, right? That's what we are in class for. We're going to get this degree, this certificate, and go start working, making some money. That's the purpose that I went to school for. It's not just to have a title. It's not just to hang my certificate on the wall and say, hey, wow, I'm a medical assistant, I'm a doctor. Oh, how nice it is. No, that's not what I want. I want to make sure that that certificate, that license, that degree that I earn means something, means money to me, because that's the reason that I went to school. So that's what you're gonna do. So you're gonna gain the trust from these people. Being nice. Just talk nice. You don't have to give anything. You don't have to bring gifts to people. No, make them feel good. Tell them what they want to hear. That's what I do. Believe me. Trust me, and you will get your way. Okay, so let's continue with this steam sterilization of, the autoclave. We're gonna check the controls. Remember, we're gonna make sure that if this autoclave is manual, we're gonna place all, we're gonna turn all the buttons to the proper settings. Remember, because usually after we finish, remember these buttons, they come back to 0 or off. So we have to set it up back again. So that's how it works. Always follows the manufacturer's guidelines. Remember, those are questions for exams. How you gonna operate this machine? You follow the manufacturer's guidelines. Always. How you gonna do this? Oh, I'm gonna follow the policies of my organization. Always follow something. Remember, we're just teaching here the basics, but each job or each medical facility where you're gonna start working, they're gonna handle things a little different. Even though if the goal is the same, they're gonna do the little things different because they have different equipment. They have different protocols. They have different labs where they're gonna send these specimens to be analyzed. So this is not one size fits all. No, you have to adapt yourself to that new arena, to that new department. And the only way to do that is to learn what they do over there, get familiarized with what they do. That's what my classes are all about. This is not just going over lectures. No, it's to tell you what is the real world. What is it that you're gonna be facing when you get there? Because a lot of things that you're gonna be facing when you start working. Believe me, a lot of stuff. You're gonna have things that you're gonna like, things that you're not gonna like. But you know what? This is like any other relationship. We cannot have it all. You're gonna have some things that you're gonna like, some things that you don't. But hey, there are something that you really need or like money. So you're gonna stay for that until you get something better, until you get experience and start moving around. That's what I did. I move around a lot. I don't settle for anything or for anybody. If I start a place and I don't like it for any reason, goodbye. But before I tell them goodbye, I make sure that I look for a place where to land first. And then I tell them goodbye without telling them, how pleased, how grateful I am for the experience that I gained over there. Because I'm gonna need these people as a recommendation, remember. So, hey, you gotta be nice all the time, even though if you didn't like the place at all. Don't close the doors, don't burn the bridges, because you never know, you might end up there or you might end up a reference from that place. So just step out from that place with your head high, up high, because otherwise, you might be in trouble. Then open door slightly. This is something that I wanted to go over. Let's go to the autoclave is here. So remember when the medical assistant was opening the autoclave, just untie it? Well, you don't open it completely. You untie it a little bit and leave a little gap. So this lid that covers this lid right here is supposed to be right here. You open it up very little, so an excess of gas or pressure or steam, whatever it is, it comes out from here. You don't open it at once, because if there is some pressure right there, that steam is gonna burn you. So remember, that's the most important thing. So when you open it up very, very slowly and leave a little gap, like 5 millimeters open. Let all this steam, this pressure come out, and then when you don't see more pressure, you remove it. Think about the cooker pressure. If you have ever used one, I don't use them, but I seen my family using them. And I look at them because I need to learn so I can give samples to my students because, it's a lot easier, a pressure cooker is a lot, more common than, at home that to have an autoclave. So it is like that. See, you have to kind of release all the steam inside this pressure cooker first before you kind of open the lid. The same you do here, you kind of open it up a little bit so steam comes out. Now, another thing, because this question sometimes comes in the exam as well. Where should the medical assistant or the person who is, operating this autoclave should be standing? See, this autoclave opens this way from left to right. So where you should be standing if you are the one who are trying to open up this and cracking it a little bit so the steam comes out. You should be standing right here. That's where you should be standing. See? Because if you stand right here, then as soon as the pressure comes out, it's gonna burn you. But if you stay right here, the pressure just comes right here because you just open it up a little bit. So it makes sense, right? So make sure that you do understand how this works, because remember, one of the major concerns or purposes, so to speak, that the examinations or the examiner are looking for is that you do not get yourself in trouble and that you not put your employer in trouble. Here you will get in trouble if you burn yourself with this heat or this thing. So you need to know where should you be standing and how to open this autoclave. So these are techniques that you need to learn. Because remember, when you don't know, just go there and try to do your best. And sometimes just the intention is not good enough. We need to actually know what we're doing. Now, when they were packing this, see, this is very small chamber inside. So there are some trays which they have holes on the bottom. These are not solid trays because this steam is going to go around and go through the little perforations or holes of the trays, through the paper, through the instruments, and circulate through these packages. So these packages needs to be placed in certain fashion. You cannot pile them up one on top of the other, like stacking them. No, you have to place them vertically. So steam goes all around. You don't place them like this. You don't place them one on top of the other. No, that is stuck. We don't stack them. We place them vertically, like this, so they are like this. See, they are like this, and they are like this, not like one on top of the other, because then, well, there is no air circulation, no steam circulation inside. So it's very important for you to understand these little details because that's what is really important. And when you're learning for someone that is going to be teaching, if you have to use the autoclave, don't jump and say, oh, I know that you're going to do this and you're going to, no, let them teach you. Because remember, it is assumed that you never use one of these. So you have some ideas, let them teach you. Because if you jump, said, okay, we're going to place this, oh yeah, and we're going to place this, and well, they said, oh, well, then do it. So now I'm not going to help you. No, teach me your way because that's the way that you do it here. And if they do it wrongly, not the way that I taught you, don't go there and tell them, oh, my professor told me otherwise. That's not how I learn. Oh, who's wrong? That's what you're telling these people. Don't do that. Don't go there and argue with these people. If they are teaching you something, learn what they're doing over there. Then you're gonna do your thing. Remember, then you add whatever you know, whatever is right, whatever you know, whatever you don't know, now you put it together. And now you're gonna do it the right way. That's how you learn, that's how you gain trust from others, and that's how other people is gonna help you. Because at the moment that you start intervening there, jumping, when somebody's talking and is helping you with something, teaching you something, we don't like it. I'm telling you, we don't like it. Think about yourself. You're teaching me how to do something and then jump and interrupt you. Oh, I do it this way and I do it that way. He says, okay, so do it your way then. You don't need to learn from me. You already know it. So whether you know it wrong or right, I don't care, but I'm not gonna help you. So be careful. And don't put me on the spot. Don't say, oh, Professor Hoyer didn't say that. Oh, Professor Hoyer told me this way. No, because once again, people have different techniques. People have bad habits. People do wrong things. So not because they not doing it right, it means that I taught you the wrong thing. No, it means that they are doing it wrong, but you're not gonna let them know. You're gonna do it the way that I taught you how to do it. So that's basically what it is. Because believe me, I've been there. I've been training a lot of people. I'm an instructor, and I've been training people for a long time. So I know how it is. So don't get in somebody else's skin because they're not gonna like it. So that's basically what it is. So once again, you're not gonna allow the autoclave to bend. So that's what it says. Open the door slightly. The girl was just telling you what to do, but she didn't go through the whole details because she actually did not autoclave those instruments. They were not autoclaved. If you look at it, the tape of the autoclave tape was not marked. So she was just doing a demonstration because if she wastes 30 minutes, well, they should edit the video, right? But it wasn't. At the moment that she was putting the trays and putting them out, they were not sterilized. So that's basic. So bend the autoclave by opening the door slightly. So that's basic. And you're gonna be standing on the opposite side of the opening of the autoclave, or the door, or this, or the lid, whatever you're gonna call it. So that's basically what it is. Now you're gonna wait like 10 or 15 minutes after you open this slightly. You're not gonna go like the girl because once again, she didn't sterilize anything. She just open it up and start removing those trays from there. Those trays are still hot. You have to use or wear special gloves for that sometimes. So I leave it open for 20 minutes or 30 minutes. When they're actually very cold, then I remove them from there. So that's how it has to do. Remember, first you don't want to get injured. You can easily get injured doing that. So allow the items, the instruments to dry completely before removing from the autoclave. That's what I'm telling you. I leave them like 15, 20 minutes, 30 minutes before I actually remove them. Because we are not like autoclaving everything, every single second. No. Remember, this is an office. Sometimes they have procedures, sometimes they don't have. So when we have it, nobody's going to be using that autoclave. So for that reason, I leave those instruments, those trays inside, those wrappings inside the autoclave for a little longer. And then I'm going to go there when I'm 100% sure that they are cold. Then I'm going to remove them. And then I'm going to place it wherever storage it is supposed to go. Remember, there is a place when you're going to store this packaging, because whoever is going to use it, whoever requires it, you know where you place it. So there's a place for them. So you're just going to look for those. cabinets or drawers or whatever the case may be. So once again, just learn. Just, if you have to do it, just ask someone who's doing it, follow them, shadow them. Oh, they're gonna do this. I'm gonna go. I'm gonna see what they're doing. I'm gonna see where they get this from. I'm gonna see how they pack this, how they place it, how they clean it, how they sanitize this. Because that's something that if we have to do it, start from the beginning, learning how to do, because you never know, you might be asked to do it. And it's a good thing to have an idea at least or how to do it. So maintaining the autoclave or maintenance the autoclave. So, well, we have just to keep it clean. Remember, after we remove whatever we have, sterilized, we're gonna make sure, that the autoclave is kept clean, because otherwise, it's not gonna function. So that's basically what. Follow the policies of your organization. Sometimes someone in there is the one that is in charge of doing this type of work. Most of the time we use like a cloth that it is, wet or damp with the detergent. You just clean it. Don't put no liquids inside or spray it with some chemicals. If you're not familiar, don't do it. Just follow the policies, the recommendations from the manufacturer company, how to clean this particular equipment, how to do the maintenance. So that's basically, if it's something that you have to do. If it's not, leave the person that, or the people who is in charge of that, to do so, not you. Let's talk about sterilization strips. Remember, so sterilization strips are not the same as the tape, the autoclave tape. Remember, this is totally different. These are little strips that we're going to put inside the package. Remember that the pouches, they have it on the package. It comes within. So we don't have to add it, but to these muslin papers, to these wrappings, we have to apply it. And when we have instruments that are not used the wrapping, we have to use an sterilization strip, place it right there alongside in the middle of the unwrapped instruments as well. Even though if after we finish these instruments, you need to use gloves. Remember, you saw the girl using, these are not sterile gloves. These are just medical gloves, clinical gloves. Because remember, they have the packages. So if you're on the outside, you can touch them with your bare hands. Nothing is gonna happen. It's just don't touch the content inside. And when you're gonna do so, then remember, when you were wrapping them up, you know how to unwrap, not to contaminate the instruments that are inside. So that's basically what it is. So the chemical indicator that changes colors when exposed to conditions necessary for sterilization. So whether it's pressure, temperature, time, place in the package, all those things are something that you have to take in consideration, because remember, the pressure is measured in pounds, and that was between 15 and 17 pounds that we're gonna place, that we're gonna kind of set up this autoclave. The temperature is between 250 and 270 Fahrenheit. The time is between 20 to 30 minutes, but once again, all depends of the instructions on the manufacturer of these particular equipments. So that's basically what it is. Now, what is it that you're gonna be placing these sterilization strips inside these packs to be sterilized? So that's how it works. So these are sterilization strips or sterilization indicators. So I believe that the exam talks about sterilization indicators. So we can use these two terms interchangeably. Remember, sterilization strips and sterilization indicators. So now autoclave tape, see, that is totally different. This is the one that we use because remember, the word that you have to remember is tape. Tape is what we need to secure the package from the outside, not inside. So that's what we're gonna use to secure, to seal that package. And usually on top of this tape is when we are going to mark with a marker. We're gonna place there the date that the instruments were sterilized, what instruments are inside the package. The girl has a package for a GYN package. It was the vaginal package. So that was the speculum and all of those things that are used to do a, we're not talking about these plastic disposable speculums that we use lately. These are metal ones that those are reusable. So basically that's what it is. Some the tissue spongy holders or wrappers. So that's basically what it is that can be sterilized without wrappings. But once again, this tape is the one that is wrapped around the package. Now, read what is here highlighted. The tape not an indicator whether the pack is sterile or sterilized. Remember, this tape is just to tell us that this package was sterilized, not that the instruments inside are sterile. No, this tape just tell us, because remember, sometimes you can prepare all these package, all these wrappings or instruments to be sterilized, but you don't put it to sterilize, you leave it somewhere. So you come and you see then, and as soon as you see the tape that doesn't have the stripes, so you know already that these packages have not been sterilized or autoclaved. So that is the only reason why these stripes are there, not to tell us that the instruments inside are sterile. So the bottom part says indicates only that the package or the pack or the packages or the packing has gone through sterilization process. That is it. And be careful with these questions on the exam because I don't want you to get confused. So what is the autoclave tape for? So what does the autoclave tape indicate? Oh, indicates that, these instruments of the package has been sterilized. That's it. So what is the sterilization indicators or strips? Those are inside the package. Those are the ones that tell us that whether these instruments are sterile or not. So when we open the package and we look at the strip right there, we see some marks, some black marks also. So then we said, oh yeah, these instruments are sterilized. But if the mark is not there, then we said, this package was sterilized, but the instruments inside are not sterile. Look at the strip. Didn't change colors. So instruments are not sterile. Therefore, instruments needs to be, again, autoclave, re-sterilized. You don't have to do anything else. You just remove this, the indicator strip or the sterilization strip or indicator. Just remove that, put a new one, and wrap it up again. That's it. You don't have to go and clean the instrument. They are not dirty. They are not sterile. So that's basically what it is. So make sure that you actually follow this. See, here are the two samples of the things that I already explained you about. Sterilization strips and the autoclave tape. So remember, sterilization strips or indicators means the same. So here we have the sterilization strips, which are this, which are this. And this is the tape. So the first one, let me use this color. So this one is brand new sterilization strip or indicator. Why? Because it's completely clear. Look at here, the second picture, it has this rectangular or whatever shape that is being blackened. See, that's what it changes. So that's what you have to look for when you open the package. That you see this indicator right here that change colors. Here it is not. So when you open the package that's being sterilized and you see it just exactly that the first one says, oh, it didn't change no colors. So these instruments are not sterilized. So we cannot use it. We have to sterilize them again. So you get rid of this, you remove this, and you place a new one. And when you sterilize again and you open the package and you see these changes right here, then you know now that the instruments inside are sterilized. The same here, if you use this type of indicator, it's clear. But here, see, it changes colors. So that's basically what it is. Now this is the tape. This is the tape without sterilizing the instrument. See, it's clear. You see the lines right here, but they are the same color, kind of brownish beige color. Here, after being autoclaved, you see these lines across, these stripes. So if you see the stripes on top of the package, you already know that this package has been sterilized. Now, once again, just because you see this tape with these stripes does not imply that the instruments inside that wrapping, that package are sterile. You have to open it up when it's needed. You're not gonna go open it up. This is open only when it's needed. If you go and open it up and you're not gonna use those instruments, they no longer are gonna be sterilized. You can just open up and say, oh, let me see if the sterile strip, the sterilization strip or indicator has changed colors to see if this is actually sterilized or not. You're not opening them up. You leave it closed, so whoever is gonna be using it, they're gonna open it up whenever they need it, and they see the strip, and if it has not changed colors, they're not gonna use it. They're gonna ask you to sterilize those instruments again, and they're gonna pick up another package. So that's how it works. So be careful because it is a lot of information and kind of sometimes, a little confusing because when we are new on the field, when we are for the first time learning something, it is difficult to grasp all the information. It is difficult. I'm not gonna blame you. I went through the same thing. Do you think that I learned this overnight? This is years of experience. I didn't learn this overnight. I was like, oh my God, how do I know? I mixed up. I mixed up the tape, the autoclave tape with the indicator and so on and so forth. I mixed up everything. So I'm not smarter than you. It's just that whenever you haven't been exposed to something, it's gonna be difficult to remember. That is the reason why I'm going over and over and over things so it can stick in your heads a little bit, at least for the time being. And if you don't use it, you never use an autoclave, well, no worries. You don't need to say, oh, I'm not gonna bother about it. No, it's just not gonna be there. But if you use it, then you're gonna bring back all these memories and then you're gonna learn and you're gonna get your own techniques to do things. That's how it works. But for the exam, I do want you to remember this because I want you to pass that national exam and be ready to get a good job. the shelf life of sterilized items. In other words, for how long can we keep this packaging after being sterilized? Well, all depends of different factors. We're going to talk about that. So the length of time an item can be stored depends on the following, of course. Instruments, we don't have a particular date, time, period. All depends. So remember, all depends the type of packagings. Instance, okay, what's going on? I hear some bing, bing, bing. I don't know. Well, I thought somebody sending me a message. So that's basically what it is. Remember, if you use the muslin paper, sometimes that can last only for 28 days, maximum 30 days. After that, if this package was not used, you have to remove these instruments from the package and sterilize them again. It's not like you're gonna place them again in the same package. No, you have to remove those instruments from there. The packages were not used. It's been already over 28 days, 30 days, whatever, the manufacturer company tell you, guidelines tell you. So that's what you're gonna do. These instruments are going to expire sometime, and if you place it in a muslin paper, remember 28 days, 30 days, these instruments, if they were in use, you have to re-sterilize them. You have to wrap them up in a different paper, put a new now how many papers you use to wrap these. So they have different techniques to do things. Number of times an item will be handled before you know you will learn how to do that. But the best thing to be safe is just follow the policies of your organization for sterilizations purposes, for how long you should keep these sterilized instruments, depending whether they're in a pouch or in the muslin papers. Environment of the storage area, it was cold, it was hot, it was this, it was that, it was humid, it was moist. Who knows how the package is sealed? So remember, if we use just the tape, the autoclave tape, we use the muslin paper, well, there's lots of filtration over there, so are not completely sealed. But if we use the patches, see the pouches, we can keep it up to 6 months because they are very secure. They are very sealed inside. So it is already packed. So we can keep them for a longer period of time. But just read. You're not gonna be asked about this, but just follow the policies of your organization and then you will figure it out how long. Here you have a table of the shelf life of sterilization of these instruments. So once again, if you wrap them in a linen wrap, then 30 days. Paper, like the muslin paper, 30 days. Non-woven fabric, 30 days. But you're not gonna have all these options. See, in your job, you're gonna have muslin paper, the pouches. That's it. There's no other choice. I don't know where they come up with all this. Well, probably before I was born, they were doing this, but I've never seen anything like this. Remember the plastic pouches? Those are perfect ones. They are more expensive than the muslin paper, but the instruments inside last for 6 months. versus 28, 30 days. You don't want that. You don't want to be sterilizing these instruments very often. So that's it. So you're going to have two choices, muslin paper and the pouches. The muslin paper, you're going to keep them for 28 days. That's what I learned. That's what I always did. Now they said here 30 days. Well, they rounded up. So 30 days it is, but 28 to 30 days. That's it, the paper. And the pouches for 6 months. That is it. So that's how it works. Okay. So we're done with this chapter. That was a lot of stuff. Any questions so far? Anyone? Okay, so let's move on to the next chapter. It's a very short chapter. We're not gonna finish it anyways. We're just gonna go over, we're gonna talk bases because it's very important to understand how to prepare the examination room. Remember, this is clinical laboratory. We start first with preventing infection, controlling the spread of infection. Then we're gonna talk about these places where the patients are going to be receiving all these procedures, how we are going to arrange, how we're going to keep this tight, how we're going to keep this, clean, because it's very important for us, because we are the one who are going to be working in that place. So it has to be a place that is safe for us and is safe for the patients, remember. So let's put this on your screen because it wasn't. Here it is. So preparing the examination room. So you're familiar with examination room. You've been somehow in a hospital, in a doctor's office, being examined by a doctor, or accompanying someone else for any procedure. Well, we have somehow, at least we have been in the medical office in our lifetime 3 to 4 times, if not more, right? So basically that's what it is. When you enter the room, you're gonna see a lot of stuff over there. So we're gonna see what do we encounter there and what is it that we do with those things. How do you arrange all the equipment that the medical provider is gonna need for this particular procedure? The tables, how you're gonna clean the tables, how you're gonna address the tables, meaning how you're gonna place the paper on top. So how you're gonna clean the counters, the tables, anything that you encounter there, the equipment that is needed to evaluate the patient's eyes, or the scales to weigh you, to check your height, or the stethoscopes. So we gotta make sure that everything is squared away. So that's basically what it is. So the first thing that we have to do is, before we start preparing the room, is making sure that we follow HIPAA protocols. Remember that HIPAA is a very, very important topic for examination. And for us, this is an everyday task, because every single time that we are in contact with patients information, we need to keep that information private, confidential, and secure. So HIPAA is going to be everywhere you go as a medical assistant, and of course it's going to be on your exam. It's a huge topic for exam. So basically that's what it is. How are you going to handle these medical records, the patient's information? Remember that the information within the medical records belongs to the patient, but the medical records belongs to the place where the medical records was created. So we discussed that in medical records management. And for those who are new, Well, that have not taken that class, we will go over that class when we get there. If it's me, we will do it. If it's someone else, well, that also will cover the same. So, room temperature. Now, think about these medical offices. When you enter these medical offices, most of the time the temperature is below, you know, environmental temperature. So most of the time is below environmental temperature. So it's a little cooler than normal because it has to be the way. It has to be a little cooler because once again, that's going to stop microorganisms from moving faster. That's why hospitals, medical offices are kind of cold because it's going to kind of help with, stopping these microorganisms from moving faster. So that's basically what it is. So the temperature inside of these exam rooms should be in between 64 and 75. Now, once again, these are Fahrenheit degrees, remember. Sometimes it's not 75. Remember, 75 is a little warmer, 70 a little warmer. If it goes below 70, it starts becoming a little cold. But that's the way it should be. Because we have to take in consideration the procedure that we're going to do and what type of clients are we having? Is this a child? Is this an adult? Is this an elderly patient? So all those things are taken in consideration. Now, you don't know that because you are not the one who is setting up all these thermostats and temperatures and whatever else is going on in a medical office or hospital. But that's how it works. That's based on that. Some of the time, they just have certain temperature, a certain level, and you have to deal with it. Now, we mentioned this because remember, some of the times the patients have to disrobe or undress or remove clothes. And this place is cold, so we have to provide them with a gown. We have to provide them with a blanket because it's cold. It is cold with clothes. Can you imagine after you remove your clothes? Now, when you place the patients inside those rooms, sometimes the medical doctor don't come immediately to evaluate or to work with the patient to do the procedure. Sometimes they have to wait long periods of time. When I'm talking about long periods of time, I'm talking about 20, 30, 45 minutes. That's a long time for someone who is in a cold room and, without their clothes, just gonna gown. We have to provide them a blanket, otherwise they're gonna get chilled. And there are certain procedures that do not work when you're chill, when you're cold. And there are certain procedures that you're not gonna feel comfortable doing it because it's very cold. So we gotta make sure that we prepare those patients close by the time that the medical doctor is gonna arrive to evaluate or to do the particular procedure on the patient. That is basically what we need to do. So it's not like the patient comes in, oh, let me take you to the room and, oh, remove your clothes and I give you this gown, see you later. Wait there until the doctor comes in. Well, you have to be considerate. Remember, these rooms are very cold, particularly if you are an elderly person. You are going to be feeling cold even though if it is hot. Can you imagine if it's cold and you cold? Not good, right? So be considerate with your patients. So that's basically what it is. So just make sure that the temperature in the room, it's not something that you can control, but then you can control how fast the patient removed or disrobe or removed their clothes, and making sure that you're not just only providing them with the gown, but also with a blanket, so they are comfortable there. So that's basically what it is. Accessibility. Now, according to ADA, which stands for the American with Disability Act, oh, by the way, this is a question for your exam. They're gonna ask you, what is the American with Disabilities Act? Then you look for, once again, ADA. Remember, ADA stands for American with Disabilities Act. This is a mandate, there is a law that every single public building, regardless, doesn't have to be public, when people go there to receive services, well, hospitals are one of them. You have to have accessibility. You have to have ramps. You have to have elevators that can hold wheelchairs, because remember, if you have to go stairs with a wheelchair, it's very difficult. With a walker, with a cane, that's going to be very difficult to walk. Or inside the medical office, you have to go a couple of steps where the exam room is at. So they have to have ramps, once again, bathrooms that are accessible with a wheelchair, sinks for people in a wheelchair, toilets that are customized for people who are in a wheelchair, and so on and so forth. So this is the accessibility that we're talking about. The American with Disabilities Act, remember. That is in the hospital, so we have to provide them. The hallways, that has to be wide enough to fit a wheelchair as well. Not something very narrow that you have to be kind of carrying the patient back and forth from the exam room. It doesn't work that way. And elevators. So again, that's what we are, talking about here. So let's talk about some of the most common instruments that you're gonna find in a medical office. Probably you are familiar with some of them. Probably you have seen them. Probably you've seen them, but you don't know what the names are. No worries. You're gonna understand. You're gonna learn. You're gonna see them. Have pictures there that you can look at it, and then you said, oh, that's what it was. Oh, I saw something on the wall there. I didn't know what it was. Well, now you're gonna know. Because you gotta make sure that every single room is gotta be occupied with all these instruments depending on what your doctor's specialty is. Remember, when you get a job, make sure that you know who you're going to be working with. Who is this person? Not, oh, it is male, it is doctor. No, what specialty they are practicing. Because there are different specialties. Are you going to be working with a GYN doctor? Then you got to prepare to be assisting during the pap smear and some other gynecological examinations. Maybe pregnancy. So again, since a pediatrician, you're going to be working with minors, with children. Do I like children? Well, I like my kids, but to work with them is a different issue. Somebody else's kids. So you gotta make sure that it's not just a job. Oh, they offer me a job, but then you're gonna be miserable on that job because that's not what you want to do. That's not what you were hoping for, so to speak. So know the specialties of these people before you sign up for something, because you might be doing something more or less work. So let's say that you work with a general practitioner, general doctor, or family practice. Remember, general doctor, family practice, they usually do the same. So what is it that you're gonna see there? An ophthalmoscope. What is an ophthalmoscope? This is an instrument that is gonna be used to examine, to visualize the patient's eyes. That's an ophthalmo. Ophthalmo means eyes. Scopes means instrument. So that's basically what it is. So let's look right here. This is an ophthalmoscope. You don't have to use these instruments. The only person that use them are the doctors. But you gotta make sure that these instruments are there and that they are functioning. That if they are battery operated, they are workable. You have to turn it on. If they are battery rechargeable, they have to be charged. Turn it on. You don't want to encounter the doctor calling you and saying, hey, this ophthalmoscope is not working. Oh, that's not my fault. I didn't touch it. I didn't break it. They didn't ask you that. They're just telling you, hey, you didn't charge it. Or you didn't replace the batteries. So you gotta get familiar with the equipment that you are gonna be working with. Because if you don't, then you're gonna be like kind of, lost. So that is an ophthalmoscope. Otoscope. Now, an otoscope is the one that we use to check your ears. Otoscope. Auto means ears, scope means instrument. So let's see right here. This is an otoscope. Now, once again, you don't have to use it. Medical doctors do it. But you need to know where is it. Because sometimes we have a portable one like this one, and they are rechargeable. So you gotta make sure that you know where is it. So if the doctor comes and says, oh, can you please pass me the otoscope? What is otoscope to begin with? No, you gotta be familiar. We're gonna talk about this when we get to medical terminology. So we're gonna talk about all these instruments, all these medical terms that are used. So you will learn a lot of stuff. But here you're learning because, once again, different subjects, different lectures, we kind of overlap material because that's the purpose of the class. To see this in several occasions so we can keep you, fresh, you know, aware of what's going on. So this is an otoscope. Pen light. I don't think that I have a pen light right here, picture, but it's a little flashlight. It looks like a pen. We just press a little button, and that's the one that we use to check your pupil reactions, reflexes. So if you have gone to the doctor and the doctor kind of shine a light on, well, unfortunately, I'm not at home in New York. So over there, I have all these. So it's like a pen like this. So they just kind of shine a light and they ask you to just look the light and follow the light. Or when they ask you to open your mouth and say, ah, and they shine the light on the back to see the back of your throat, to see if you have an infection or something that you were complaining about it. So that's a flashlight or a pen light. Tape measure. Remember, depends where you're working. If you're working with a pediatrician, you're gonna have a tape measure. Why? Because we are going to measure the head circumference of the child. We're gonna measure the length, how tall they are, the height, and maybe the chest circumference sometimes is required, or any other thing that you need to do. But these are the more frequent things that we do. Reflex or percussion hammer. So I think that I do have those right here. Yes, this is the percussion hammer. Remember, hammer, we know it's a hammer, right? But this is a hammer that doesn't have metal at the extreme. It has a rubber. And what we do is check the reflexes of the patient. You don't have to use these instruments. You need to know where they are. Some of the doctors never carries anything, they never know anything. Some of them are new, just as you are new, so they don't know where things are. But they assume that you were there before assisting other doctors, so they assume that you know where the things are. So you gotta get familiar with them. Go over there, open the drawers in the doctor's office, on the cabinets, on the laboratory, look everywhere. What is it that are here? Get familiar with the surroundings, learn things. So if someone asks you something, you don't have to be wandering around or looking for someone, and even worse, looking like you don't know what you're doing. Because remember, people are, expecting you to know things. So basically, this is the percussion hammer. Let's see what else is here. The turning fork and audiometer. Turning fork, when I see the turning fork right here, this is the turning fork. This is to check sounds, to check problems with hearing, with the patient said that they hear from one ear, from the other they don't hear, that they probably feel that they have something inside, maybe wax, maybe a cotton from the Q-tips, maybe a cockroach that got there, who knows. So we're gonna evaluate the hearing from the patient. So that's basically what it is. Probably you have to do this, so we're gonna talk about two common tests that are done use this turning fork. That's basically what it is. Now, there is no questions about these instruments in particular that you're gonna have in your exam. For instance, they're not gonna say, okay, what instrument you're gonna find in your, no. But they're gonna ask you, for instance, what is an ophthalmoscope? What is an otoscope? So you need to know those. So here we have. So otoscope, remember oro means ear, and scope means instruments. An instrument to check the ears. It's to check the ears, not to measure hearing. No, that's an audiometer. That's something else. That's totally different. So that will be the last one. Let's see if we have it here. No, we don't, because we don't use that much. That is a specialist that uses that. So that's basically how it works. It's very interesting for us to understand how this works. So let's talk about these two types of hearing tests that probably you are going to be performing, because these are very simple tests. When I was a medical assistant, I performed these tests. When I became a doctor, I already knew it, so it was PCK for me. But it's very simple. The first test is called the Rhine test. Sometimes they pronounce it as the Rene test. Sometimes they pronounce it the Rhine test. The Rene test or the Rhine test, this is the name of the doctor who discovered this test. So that was Dr. Rene. So that's basically what it is. So it is a test. But remember, sometimes you're gonna hear the Rhine test or the Rene test. So either or is the right way to be pronounced. So now, what is it that we're gonna do with this test? Here we're gonna check the hearing from both sides with the turning fork. So what is it that we're gonna do? We're gonna check bone conduction. That's the first one. And placing the turning fork, right? Air conduction and bone conduction. We're gonna check two things. So first of all, let's look at the picture. So this is what we're gonna do. We are going to first make to vibrate this turning fork. So this turning fork, we're gonna hit it. This part right here, we're gonna tap it. Or usually I just, hit it against the palm of my hand right here. With the palm of my hand, I hit it like here and start vibrating. So you're gonna hold it on this area right here because it ends like this. So you're gonna hold it from here and you're gonna place it close to the ear, not touching the ear, but very close. And the patient, you're gonna tell the patient if they hear the vibrations. So you let it go until the patient tell you that they no longer hear the vibration. So before you start the test, you're gonna tell the patient, Mr. Miss Smith, I'm gonna check your hearing. This is a hearing test. Don't tell what test it is. Just this is a hearing test. So what I'm gonna do is I'm going to place this instrument close to your ear. You don't have to tell them this is a turning fork. No. I'm gonna place this instrument close to the ear that you said that you cannot hear from, and you're gonna tell me if you hear this instrument vibrate. You hear a vibration. When you hear the vibration, said I hear the vibration. Then when you no longer hear the vibration, you're gonna tell me I am no longer hearing the vibration. Because when you no longer hear the vibration, you gotta move this turning fork and place it right here on the back of the ear over this bone right here that is called the mastoid bone. So right here, see the mastoid bone process. This is what you're gonna do. First, you place it in front of the ear canal. You no longer hear the vibration. I can no longer hear the vibration. I move the turning fork and I place it right there, touching the bone on the back of the ear. Then you're gonna tell me if you feel the vibration, because you're still gonna feel the vibration. If you don't feel the vibration, then you have a problem. So that's basically what it is. But you're not gonna tell them anything about diagnosis. It's just the test. So that's all you're gonna do. So remember, the patient is gonna come to your office saying that they cannot hear from this particular ear, the right or the left. Oh, I don't know, maybe I went swimming, maybe I was taking a shower, maybe I was cleaning my ear with something, I don't know, maybe something got inside there, maybe I have a wax, but I cannot hear well through this ear. Then it's when you do the test, and you do it on that wrong ear. So that's basically how it works. Now you can do both ears if you want, but anyways, that's the test. Then the second test is called the Weber test. Weber was the name of the doctor that invented this test, the same as the Rene test. So that's basically what it is. Two medical doctors that there were audiologists that discovered this test. Now this test is a lot easier. Why? Because the patient is gonna come over and is gonna say, oh, I cannot hear from this ear. We're not gonna do this. Or we did this. Or not. No worries, because there are two different tests. So what we're gonna do now is we're gonna place the turning fork right in the center on top of the head. So right here, let's go back to the picture. Oops, let me see. No, cannot see. Let's say right here. Here, right here in the front, right here in the middle of the head, we're gonna place the turning fork. So the turning fork is like this. So we're gonna place this base right here, touching the scalp after we make it vibrate. So instead of putting it in front of the ear, we're gonna place it right here on top, on the apex of the head, right here. So we're gonna tell the patient, okay, so I'm gonna place this instrument right here on the top of your head, and you're gonna tell me if you hear the vibrations equally in both ears, or if you hear the vibration more in one side than in the other. So that is basically the test. So as soon as you tap the this turning fork and you place it right there in the center, the patient is gonna say, "Oh, I hear more right here on my left ear." Now, okay, no, I hear the same vibration. I hear the same sounds here and here. Oh, I don't hear anything from this ear. If the patient tell you that they hear more from the right than from the left, the right is the problem. When you hear more, that is the problem. If they hear equally, they have no problem with the ears. There is gotta be something else. So that's basically what it is, and you're gonna document it in the patient's medical record. You're gonna tell the doctor, here is the test results, this is what I got, and that's it. Now, most of the time you don't have to do it, the doctor do it because it knows what they're doing, know how to diagnose, and do it right away. So basically, and it does it right there in the medical office. So once again, just in case you have to do it. Anyways, for during the phlebotomy that we are going to have presential classes in EKG, I'm gonna bring my instruments because I have them, and I'm gonna show you how to do this, particularly the Rhine or the Rene test and the Weber test, because it's very interesting to know just in case, because it's very easy, fast, and it's a lot easier that I tell you how to do it versus, just showing you how to do it. So that's how it works. Any questions about these instruments and these tests? Now, before we call it the night, pay attention because this question was sometime on the exams. It can come back. So if you have, because it was either or, remember, Renee and the Weber. So they're not gonna ask you how to do the procedure. They're gonna ask you what is this test for. So if you ever encounter in your exam, because I will be giving you this question in your final, if you encounter in your exam that, what